My name is Paul Dsane-Aidoo. I'm a medical doctor practicing in Kosoa, where Jesus lives. And Kosoa is a suburb of Ghana. I have in my hand a profound document that I have the permission to share with you. But before that, I'll give you the backdrop story to this. A 13-year-old girl was raped, and when her story becomes public, 4 important people in her community assist the rapist to draft the document, and these 4 people sign as witnesses to the effect of this. Now, the irony is that this girl has a poor, unschooled, single mother who cannot read or write, and yet is forced to be bound by the agreement of this document. Here is an original copy of the document, and I read. The title is An Agreement Note on a Sexual Affair Case. This is to certify that I, name of rapist, have agreed to pay any cost which will be incurred after the medical examination which will be carried out on the 27th of August 2015 and November 27th. I have agreed that I had sexual affair with her, name of girl victim, and ready to accept any results which may come after the medical examination which will be carried on the girl. Initially, I was charged with 500 Ghana cedis as compensation to her mother, of which I am about to pay from today. We all have agreed to this, that the case should not be taken to the police station or the Commission of Human Rights and Administrative Justice. Signed 4 witnesses. Absolutely shocking. A memorandum of understanding to cover a case of sexual violence in our communities. Well, a few months pass by, and the mother of this girl does not receive the payment as promised, and so she attempts to make a demand. But unfortunately for her, she gets kicked out from her home because her landlord happens to be the friend of the rapist and also a witness to the document. When society pays off a girl victim of sexual violence and her poor mother an equivalence of $125, just $125, to cover up a crime as grave as sexual violence, then you know that we have all failed. The World Health Organization says that sexual violence is a serious public health and human rights event that may affect the physical and the mental health of the victim. But in this case study, we understand that in our society, sexual violence affects more than the survivor. Sexual violence affects the family. It affects our community. A research done by the U.S. Bureau of Justice Statistics shows that 1 out of every 53 college women have been raped with a peak age of 18 to 24 years. In Ghana, according to the Domestic Violence and Victim Support Units of the Ghana Police Service, between 2002 and 2006, the cases of sexual violence against children have been on the rise, up to about 2,500 cases by 2006. And so we have an emergency at our hand. Now, even in our society, the issue of sexual violence is even more complex regarding the sociocultural and the moral framework that we live with. Victims cannot tell their stories. The communities are silent about it. But as a medical doctor sitting in the consulting room, I have the sole privilege of hearing pure, untold stories of sexual violence. And so I decided that together with some of my colleagues at work, we would conduct a research on the extent, the nature, and the consequences of sexual violence on the victims and their families. We were focused on looking at the physical effects on the victims and the psychosocial effect on our communities. Now, let me tell you how close sexual violence is to you and your family. The research showed us that up to 80% of the rapists are people who are actually close to the victim and her family. This is supported by research that was done by the U.S. CDC, the Center for Disease Control and Prevention, they published that over 80% of rapists are actually close to the families, the victimized family. We have a menace at hand that we have to rise up and fight. Now, let me give you something shocking. And so it means that our idea of a rapist as some kind of a distant person who is some big bully who does not care is wrong, it's flawed. Actually, only 20% of rapists are strangers. So we wondered, did these children report the cases to their parents? Did they report their cases, the cases of sexual violence to their parents? And we found out that 80% of the girls, or the victims, because we found out the boys were also being victimized, 80% of the victims, if you can go back on the slides, shows that 80% of the victims never reported the cases to their parents or to their close relatives. It means that it took incidental occurrences like the girls being pregnant or having very bad pelvic infections for the patient, for their parents to identify and report the cases. So the question is, why are the girls not reporting? 80% of them. Why are the survivors of sexual violence not reporting? Traditionally, we thought that the rapists threaten them. The rapists threaten their victims and tell them that if you report, I'm going to kill you, I'm going to harm you. But we're surprised again. Actually, only 25% of the victims did not report because we are afraid of the threats of the rapists. And about just 25% also did not report for other reasons like diminished self-image. But up to 50% of the girls did not report the cases because they were afraid of how their parents were going to react. 2 times more than those who were afraid of the rapists. And so are we right to conclude that parents are twice as scarier to their children than rapists? Where are the parents? Where are their priorities? I'll tell you their priorities. Now, this was an incidental finding, purely incidental. It was not related to our research. We found out that when the parents brought their victimized children to the hospital, they were more interested in finding out whether the hymen of their children was intact, rather than seeking medical care for them. Now, the hymen is that membrane that seals the vagina as a physical evidence of virginity. It is shocking to know that the psychological trauma of these girls and their need for healing have been totally neglected for some sociocultural pride of preserving the virginity, some supposedly virginity of these victims. What is wrong with us? Now, as part of this research, we are counseling the parents and the victimized families and the survivors of sexual violence. A father in one of the counseling sessions confessed that after her girl had struggled over months of being abused by her teacher to tell the father didn't talk to her daughter for 2 weeks. In the same house, 2 weeks. Why? He confessed that he was disappointed that her child was no more a virgin. He was disgusted. But at who? What has happened to us? We all of a sudden have this form of social obsession about our culture that we do not know, even understand ourselves anymore. In trying to honor our culture, we have dishonored the survivors of sexual violence. In trying to make sacred our sexuality, we have lost our instincts of fighting the crime of sexual violence. That crime that so desacralizes the sexuality of our society. There's a quote I'll share with you. And this quote, I think, is from an anonymous source, but I think that it is probably by someone who is a victim of sexual violence. Or maybe this person knew a victim or a survivor of sexual violence. Or maybe she's a feminist activist. This is what she says. When I am raped, people say I've lost my honor. How did I lose my honor? My Anna is not in my vagina. It's a patriarchal idea, she says, that my rape will define the Anna of my community. I'd like to tell everyone, why did you place your community's Anna in a woman's vagina? It's the rapist who loses his Anna. We don't. Sense the frustration? This is what every survivor of sexual violence is saying in our African communities. As our cities emerge in Ghana and across our continent, governments, NGOs, individuals, we have all focused on medical epidemics, meningitis, Ebola, cholera, malaria. These medical epidemics have consumed our attention as far as public advocacy is concerned, policy making, and even funding. And yet, in the heart of our society, it's a more pervasive and a more destructive event of sexual violence, a crime I call the emerging social epidemic. I'll tell you another story. A 17-year-old girl was brought to my consulting room. And her story is that her father has sexually violated her. 17 years. Her biological father has sexually violated her from the age of 9 years up to the age of 17 years. 8 years, a father was abusing his daughter. She says that the father had forceful sexual intercourse with her at least 3 times in a week, continuous for 8 years. By the age of 14 years, she was pregnant for the father, and he forced her to abort the pregnancy. As she approached teenage, she gradually was resisting these events, and every time she resisted, the father beat her. By age 17, the resistance was getting fierce, and it was in one of these encounters that a neighbor overheard and reported to the police, and she was brought for examination. Now, this is a totally unrelated story you see on the screen. In another suburb of Ghana, I was shocked to see this in the dailies. Another biological father who had abused his own daughter for 4 years. Similar story. So we pursued our story. Sometimes we go to court as witnesses to these events. And we were successful because this rapist, this father, was prosecuted and finally jailed to a sentence of 10 years. But is that success? Is that real success? The point is, even when we as a society, as a government, as a people, focus and will give attention to sexual violence, our interest is in punishing the offenders. Our interest is in jailing the rapist. We are satisfied as far as the rapist has been imprisoned or punished. But is that what satisfies these girls? No. What these girls need is not our definition of social justice. These girls need our protection. They need social support. My heart was broken when doing this research. I realized that there was almost no social structure to follow up these girls, to follow up in school, to make sure that they are really well integrated into their societies. Nobody cares. We are happy once the rapist is jailed. Ladies and gentlemen, as we rethink, I want us to understand that the issue of sexual violence needs to be addressed holistically. And in addressing it holistically, we need to start talking about it. In one of my psychotherapy sessions, I spoke with a young girl, 14 years old, survivor of sexual victim, and I asked her, what do you want? What do you need? And this was her answer. She said, Doctor, I need someone to talk to. Thank you.